Those are the ones that carry your whole weight. Bad feet can cause anywhere from foot problems, knee problems, hip problems, back problems. You have four major systems: circulatory system, orthopedic, dermatological, and neurological. Diabetics can develop a condition called diabetic neuropathy, where the nerves in your feet are the first ones to go, and they cause decreased sensation, and sometimes even if you step on a needle,
Right.
okay, sometimes you don't feel it, okay, and that's why it's so important to check your feet, which is probably the last thing we check in our body.
Right.
Get up in the morning, take a shower, fix our hair, face, our body.
Don't even think
feet,
about your feet.
correct.
Right?
So it is important to check your feet. Okay, make sure there are no infections, there are no cuts, bruises, any kind of trauma to your feet, which can cause.
Right. So especially for a diabetic, right? I mean, foot care is even that more important for a diabetic. Can we talk a little bit about that?
Sure. Like I said, diabetes. One thing I want to clarify: sometimes diabetics also have poor circulation. Even though it can happen, it's usually not the case.
Right.
Okay. If a patient is diabetic, uncontrolled, and has bad circulation, then it's two major problems.
Right.
Okay. Because when your diabetes is not under control, nothing works.
Right.
Basically,
Right.
if you for infection, take antibiotics. They're really not as effective.
Right.
Because of your diabetes.
Right. So, I mean, like you said, this is something that folks should get ready in the morning. You're getting ready to run out. And a lot of times, folks, when they're running out, even, especially diabetics, I mean, they're not drying their feet very well, and the moisture is setting up and everything else. But Dr. Caterino, we do have a caller. Caller, you're on the air.
Good evening. How are you? Thanks for being on CAN TV. It's a great service.
Well, thank you.
I just wanted to get a quick, not a diagnosis, but maybe some advice. I take very good care of my feet, by the way. I dry them off all the time. I powder them, lotion, everything. It's all good. But when I get up in the morning and I put my feet down first thing, they hurt. And I really kind of do this strange little walk all the way to where I'm going before. And it takes a few minutes before it starts to feel normal. Is that something you could talk about right quick? And I'll get off the air to let you respond. Thanks again.
Absolutely. Thank your caller for calling.
Sure. There's several things you have to take into consideration. First, are you diabetic? Okay. Second, where is the pain? If the pain is in the heel, it's one problem. Okay. It's probably orthopedic. If the pain is all over your foot, okay, you start walking, and then as you walk, it gets better. It's a different condition. Okay. So it depends on a lot of different things. Does it hurt when you first get up and it gets better as you walk? Does it hurt when you first get up and it gets worse as you walk? It gets worse with activity. Okay, these are things you really have to be concerned about. Is it the bottom of your foot? Is it the top of your foot? Is it in between your toes? Okay, so three different conditions that can affect your symptoms.
Right. And again, if this is something that's ongoing, caller, I mean, I would think that if this has been going on for a while, you should see your doctor immediately, whether it's your primary care physician or a foot specialist. But
Yes, I agree. The main thing, whenever you go for a physical checkup, physical exam, make sure your doctor checks your feet.
Always.
Okay, it's very important. Okay, sometimes simple things like dryness. Okay, dry skin. Sometimes you can think, well, it's just dry skin, and the dry skin can be related to fungal infection. It can be related to other symptoms or other health problems.
Right. We have another caller on the air. Caller, you're on the air.
Hello, doctor. I have a problem with my feet.
And what kind of problem is that, ma'am?
It's damp in the wintertime, all the time. It's perspiration. And I'm not a diabetic, but it's...
So your feet are perspiring all the time?
Right.
Okay, and all right. We'll have the doctor address that for you.
Okay.
Yes.
Okay.
Thank you, caller.
There are a couple of things. One is it's called hyperhidrosis. Hyperhidrosis is excessive perspiration in your feet. If it's usually nerve problem. Okay, the problem is if your hands also perspire a lot with your feet, it's one thing. If it's only your feet, it's a little bit different. It's not as serious. Sometimes it's related to the synthetic shoe wear, or sometimes stockings, synthetic stockings, which cause excessive perspiration. One thing you can do is do some soakings in Epsom salt or water and vinegar. It usually tends to dry up the your skin and take away the perspiration. In case it doesn't work, then there's something we can prescribe, which is an antiperspirant for your feet. It's called aluminum chloride, and it's very effective.
So, doctor, in a case, and I do want to go back to the first caller as well, but the young lady who just called, synthetic socks, for example, a lot of individuals don't realize that cotton socks are really the best socks to wear.
Yes, natural fiber is always the best because it allows the foot to breathe, the skin to breathe, and it absorbs the perspiration. Okay, synthetic, okay, it heats up the skin and causes the body to perspire more.
And when we're talking about synthetics, we're talking about socks that contain nylon and things like that.
Yes.
So it's not absorbing anything that's coming out if your feet are moist or wet and perspiring or sweating. So cotton socks is usually what's recommended.
Yes.
Although a lot of times those are even hard to come by because they just don't make them 100% cotton anymore.
That's true. Athletic socks are good. Socks for diabetics are also recommended. Okay, they allow the skin to perspire. See, the purpose of perspiration is to cool off the skin. So when you wear synthetic materials, it heats up the skin and it causes the body to perspire more to try to cool off the skin.
And so that's a very good question, caller. And definitely, if this is something that's ongoing, and if you've tried changing your socks and maybe going with a cotton blend socks or an athletic socks, as the doctor suggested, then definitely, if that works for you, that's fantastic. And then you probably got to the bottom of what the problem may be, which is probably the synthetic socks. If that's not the case, absolutely see your physician, and that's something I wouldn't wait on because that can turn to something more serious.
Yes. Things like fungal infection. Okay, it's very simple. Fungus is something that's everywhere. Okay, and it grows in a dark and moist environment. So if you perspire more, the fungus is going to grow more. So you can develop dry skin due to fungus. You can develop, if the infection goes to nails, you can develop thick, yellow, discolored nails. Sometimes they get ingrown, deformed. These are things that can be avoided if you know what the problem is.
Right. So, doctor, going back to the first caller, I know that he was saying as he woke that he had pain,
Yes.
and he had to walk it off. Basically, is what he was saying, if I understood him. It was that he had to walk off his pain, and after a while, it would go away.
Yes.
So, obviously, this is something that, again, if it's a long-term thing that's continuously happening, it's definitely something he should see a foot specialist for or his primary care physician.
Yes, because without a physical exam, it's very hard for me to say exactly what is it, what was the cause of it. It could be something as simple as plantar fasciitis to something to do with the tendons or nerves.
Right.
But usually, if it hurts when the first few steps after resting, or when you get up in the morning, and then it gets better as you walk, it's not as serious as some of the other conditions.
Yeah, and I've heard somewhat even at our community events where patients will describe, well, not patients, but attendees will describe a feeling of numbness even after sleeping and then getting up in the morning and going to step on their feet, and they feel a numbness.
Yes. Now, that can be due to several things. Usually the problem is in their back. Okay, either a
Could be the mattress, right?
Could be exactly.
Could be the
exactly.
mattress,
It could be the mattress.
Right.
It could be maybe an old mattress or not a mattress appropriate for your back,
Right.
which can cause abnormal pressure on your nerves in the back, and the resulting numbness in your feet.
Right. So it could be a simple fix in some cases. But for both callers, definitely it sounds like something that if it's prolonged, it's ongoing for a long time, don't let it go so long where you're not seeing somebody. You don't want it to get worse. You actually want to get and address this issue as soon as possible. So obviously our recommendation is to see your primary care physician or see a foot specialist for that. Now, doctor, we know that, you normally take a shower every day, or at least you should. And if you don't, wash your feet every day. Why, why is it so important to wash your feet? I mean, we know there's hygiene, but there's emphasis on the feet.
Yes, this it's very important to wash your feet for several reasons. In between the toes, that's where the most perspiration occurs. The moisture that's left in between the toes, in the inner spaces, okay, can cause several things: growth of bacteria, growth of fungus, growth of viruses, which can cause also foul smell. Okay. Which many people complain about. Okay, oh, my husband takes off his shoes and I have to leave the room. Okay, it's usually not.
It's a usual complaint.
It's usually not a serious condition.
Right.
Okay, usually the foul smell is caused by a bacteria or a fungus. Okay, you treat the underlying cause,
Right.
problem goes away.
Right. So, doctor, then let's go back to diabetes or diabetics as well, because I know a lot of times patient or members or people, individuals who are diabetics tend to take care of their own feet and will cut their own toenails and will do not take care of the feet the way they should, smoothing them out, putting on creams, making sure that things are not left between the toes.
Sure.
Because I've seen individuals actually put cream on their feet to soften them, which is great, because you want to, especially if you're diabetic, you don't want the cracks to get infected. But leaving cream between their toes, which is not a good thing to do.
No, because you leave moisture
Absolutely.
between the toes. Now, I do not recommend anybody, especially if they're diabetic or if they have circulatory problems in their feet, to cut their own toenails, shave their own calluses.
Right.
Even though many people do.
Right.
Two things you should not do: shave your calluses and use that corn medication. Okay.
And why is that?
Because it's an acid. Okay, it's an acid that can burn. Okay, if you're diabetic and you get burned and you have neuropathy, okay, you don't feel the pain, you don't feel the burning, and the problem worsens. And
So,
then
of course, if you don't feel anything.
that's the problem. Pain
Right.
is something
Right.
nobody likes pain, but it's something it's important. That's something is very important because it's a warning of the body to the body that something is wrong.
Right.
Okay, diabetics unfortunately don't feel the pain because they
Right.
have diabetic neuropathy.
So it keeps going. It gets worse and it progresses to get something to work.
Correct. And
Right.
then you don't feel the pain. You step on something. I've had patients come in with a shoehorn in their shoe. They never felt it.
Oh boy.
Okay. I had a patient come in with a swollen foot, no pain.
Right.
Okay. Take X-rays, said she had a broken needle in her heel. The only reason she came in was the foot was swollen.
Oh.
Okay, but was infected.
Right.
Okay.
Right.
So these are things that you really have to keep in mind. Do not cut your nails. If you cut yourself, something very small in a diabetic can have devastating
Absolutely.
consequences.
Now, doctor, I also know that there are diabetics that I've also seen that have water blisters
Yes.
on their feet from their feet rubbing on their shoes.
Yes.
So why is it so important to make sure, especially diabetics, but even foot care in general, to get the right shoe?
Okay. Because first of all, the shoe has to be comfortable from the first minute you put it on. One common mistake is, I like this style. It's tight, but it'll stretch. Not a good idea, because the leather that they used to use
Right.
20 years ago, it's not
Right.
the same leather they use today.
Right.
They have more chemicals. They don't
Right.
stretch as much. It's not as
Right.
flexible. It's not as soft.
Right.
Okay. So the shoe has to feel comfortable from the first minute you put it on. And I also advise to buy shoes in the afternoon or evening, never in the morning.
Right.
Okay. When you're on your feet all day, your feet tend to swell a little bit. Okay. So if they're comfortable in the afternoon, they'll be very comfortable in the morning. If you buy shoes in the morning, by afternoon,
And they're going to
feet will
hurt.
swell. They're gonna hurt.
They're going to hurt.
If they're diabetics,
Right.
they can have other problems.
Right. So definitely shop for shoes later on in the afternoon after you've walked on your feet all day.
Yes.
Absolutely. So we protect, the other thing too is that I've seen that a lot of times individuals will go without socks, and that's usually a no-no when they're wearing shoes and no socks.
That's correct. Okay. Like we said before, the using socks, especially cotton socks, they absorb the moisture and they protect the skin. Okay. If you wear shoes without socks, especially sneakers, okay, the shoes tend to rub against the skin, bare skin. So it can cause blisters.
Right.
It can cause sometimes allergic reaction to the synthetic materials. Other infections such as fungi or bacterial infections. Okay, it's things that can be prevented
All right.
simply by wearing socks.
Okay, so here's a good one for you. I see a lot of folks, especially during this time of the year,
Okay.
with their feet next to a heater.
Oh, that's a definite no-no. Especially diabetics, they have to avoid extreme temperatures.
Okay.
Extreme cold, extreme heat, it needs to be avoided. Okay, because with diabetic neuropathy, you lose the sensation in your feet. Okay, if you lose the sensation, you can get frostbite. Okay, not even feel it. Okay, sometimes you go inside, put your feet in front of the fireplace, then you fall asleep. Get first, second degree burns. Okay, which can have devastating consequences.
Absolutely.
Okay,
Absolutely.
especially in diabetics because they don't feel it.
Right. Now, this is where sometimes or maybe that water blister occurs from. Now, those water blisters, I know that sometimes individuals feel they can take care of this on their own. And that's really something that a diabetic especially should not do, where they go and they bust this water blister.
That's a no-no with anybody. You should
Right.
never pop a
Exactly,
blister. Okay?
exactly.
Because the danger is infection. Okay,
Right.
infection in a non-diabetic is bad, but it can be treated. It's easily treated. Okay, an infection in a diabetic is much more complicated, especially if the diabetes is not under control. Okay, and they also have poor circulation
Right.
or diabetic neuropathy.
So, doctor, I know you had mentioned, you alluded a little bit earlier, that as individuals are going to see their doctors either for their annual physicals or if not, at least once a year, you should have your feet checked, correct?
Yes. Yes.
Twice a year. What's the actual recommendation?
Oh, it depends on the condition. If a patient has deformed feet or quite a few problems with their feet, if they have bunions, if they have hammer toes, depending on the type of shoes they wear, if their blood sugar is uncontrolled, okay, then they should see their physician more often. If a patient is well controlled, a recent diabetic, then twice or 3 times a year would be enough.
Okay. So it's really, really important to pay attention to our feet, especially if this is what holds us up.
Yes.
And it's definitely
Yes.
something we want to take care of and pay attention to. Drying your feet, very, very important, especially dry between the toes always,
Yes.
right? Putting on that lotion. And it is a recommendation to put on because there's so many different lotions out there. So many different things that you can pick from. I mean, what is really a good lotion for your feet?
There's several lotions. The important thing is to apply the lotion after you shower. When your skin is still moist, there's still moisture inside the skin, you want to lock that in. Okay? If you take a shower in the morning, you use your lotion at night, it's really not
And doing what it's supposed to
it's
do.
really not
Okay.
not helping that much.
So when the pores are wide open,
And it's
And-
moist
and
and,
it's
the water's in
moist,
there.
right.
That's when you want to use the lotion.
put that lotion on. So it doesn't matter what lotion it is.
Not really.
Perfume, lotion, I mean, does it matter?
No, it's the same. Jergens is a good brand.
Okay.
Um,
Basic, inexpensive, and good to use.
yes.
This is good. So when you see your doctor and diabetic shoes, that's another thing we wanted to talk about. I know there are all types of shoes out there, and I've seen individuals who will decide to just buy a bigger shoe versus a recommended diabetic shoe. What's the difference between the two?
Well, a diabetic shoe is usually has a material inside the shoe which is called plazazote. Basically, it accommodates the foot and it takes the pressure off certain parts of the foot.
Okay.
Okay, using bigger shoes, if you wear 9, you want to wear 9.5. It's not recommended because when the foot moves too much inside the shoe, then it causes blistering, it causes calluses, and it causes more problems than the diabetic shoe.
So later on, actually, it's going to come that worse.
Yes.
So a real big question I have for you now, with all these new changes with the Affordable Care Act, the ACAs, the ACs, the insurance exchanges, and all of that, are diabetic shoes now covered for everyone, should they need it? Is it something insurance now is looking at and providing additional coverage for especially diabetics in general who are looking to now purchase those diabetic shoes if need be?
The most insurance companies, especially Medicare, usually allow one pair of diabetic shoes per year.
Okay.
Okay. If you don't have diabetes, most insurance company will not allow it.
Okay.
Will not pay for it. Will not cover it.
But Medicare does cover it.
Yes, if you're diabetic.
If you're diabetic. So what are some of the things, Doctor? I mean, our time here goes by really quick. So if you were able to tell our viewers, what are some of the things that you would like to leave them with? What are the things that they should remember?
Okay, for diabetics, make sure you take very good care of your feet. Check your feet. The reason it's important for your doctor to check your feet is most people can't see, especially older people.
Right.
They're not as flexible. They can't see between the toes. They can't see on the bottom of their feet. Okay, so it's important for somebody to check it, make sure there are no abnormalities.
Right.
When you buy shoes, remember that if you play sports or if you're involved in physical activities, use the right shoe for the right activity. For example, if somebody plays soccer, okay, you don't want to use running shoes to play soccer,
Right.
because chances are you're going to sprain your ankles.
So it doesn't have the same support. Right?
Exactly. Okay. Every sport has a certain type of shoe. The usually the decoration that you see on the outside of the shoe, okay, it's not really not decoration. It's there for a purpose. Okay. The more stitching, the more support is there for the shoe.
Okay.
Okay.
Oh.
So tennis shoes have, say, flatter sole. Running shoes have unidirectional support. Okay. Because when you run, usually run in one direction.
You would think.
You would think.
So every shoe, obviously, they're called running shoes or tennis shoes for a reason.
Correct.
So buy the shoe that you're going to utilize for the sport that you're going to play.
And also
or
the
activity.
shoe. Yes, and the shoe should feel comfortable from the first minute you put it on. Okay. Like I said before, don't think, oh, the shoe will stretch.
Right.
Well, I like the style, but it doesn't really fit me. But don't think like that.
I can get into that 7 heel, even though I wear a 7.5.
Oh, you can't tell. I can tell how many patients come
Sure,
in.
I can. It's the designer. It depends on the designer.
I have patients come in, argue with me. Okay, I said, but doc, this is not right. No, you're wrong. I said,
Right. Well, and I really get that, because I know a lot of women out there will get into shoes or buy something smaller, or it feels like you're saying, it feels great at the store, and even though you're 7.5 and you try on a 7 and you feel, oh wow, this really fits me. In reality, it's not going to.
No. Also, another thing, I noticed a lot of people order shoes online. It's not a good idea, because you have to try the shoe on. Depending on the style of the shoe, numbers may change.
Right.
Okay.
Right.
With me, sometimes I wear
Absolutely.
9, sometimes I wear 9.5, depending on the style of the shoe.
Well, Dr. Caterino, I wanted to invite our viewers that if they have any questions regarding foot care, or they have questions for you directly, they can feel free to give you a call at Family Med Center. You're located over at 5700 West Ermac Road in Cicero. Area code 708-863-6166. Again, if our viewers have questions or would like to talk to Dr. Caterino, please give them a call, 708-863-6166. In addition to that, since we're talking about running, I'd also like to invite our viewers to an event that we have up and coming over at Illinois Masonic Medical Center. And we have a program called What You Need to Know, Diabetes and Your Feet. And this program is coming to you Saturday, January 24th at Illinois Masonic Medical Center. And you can call Hispanocare at 773-296-7157. You can reach us there at any time, or go on to Hispanocare.org. www.hispanocare.org, and you can get the schedule of our community events for the entire year are now listed. Doctor, our time here goes by so quickly, and I want to bring you back because I know there's a whole lot more, especially with surgical procedures that are happening and all of that. So
Sure.
Thank you so much for coming. Really do appreciate
Thank you for having me.
Caterino. Thank you for coming. And to our viewers, thank you for watching CAN TV Cable 21. Until next time, please stay tuned. More information coming your way on behalf of Hispanocare Advocate, Illinois Masonic Medical Center. Thank you for watching. Till next time.